Welcome, and thank you for taking the time to join us today. My name is Laura Dye, and I'm the Federal Grants Director of Operations for Big Brothers Big Sisters of America. On behalf of our federal grants team, I extend our appreciation for your efforts to strengthen our mission and support your littles as they pursue their full potential. This training continues our series in partnership with the DEA Educational Foundation and is generously funded by the Office for Juvenile Justice and Delinquency Prevention. Our moderator for this session is Meredith Lappelt, CEO of Rising Star Publicity, who has guided thousands of business leaders and entrepreneurs to unearth, execute, and communicate their big ideas. Since 2012, Meredith has consulted with the DEA Educational Foundation with a focus on the national youth programs. Over the years, her work has covered a variety of projects, including evaluation, media, development of drug awareness seminars, launching youth programs in new cities, and more. As a speaker, author, and business coach, Meredith thrives on guiding leaders to spread their messages and mission so they are noticed and celebrated. She lives outside of Columbus, Ohio, and continues to invest her talent into helping the DEA Educational Foundation with its important mission of drug abuse prevention. And with that, I will turn it over to Meredith.
Thank you so much, Laura, and thank you all for being here. We are really excited to be here with you all today. We here at the DEA Educational Foundation really appreciate the partnership with Big Brothers Big Sisters to create and deliver these important trainings to you. We've got a great program for you today, but before we get into the program, I'd like to just let you know that we will take some questions at the end. So if you have questions, put them in the Q&A below, and we will get to those toward the end, as many as we can. And to get us started, let's just do a quick thing in the chat where everyone puts in an answer to this very simple question. And that is, if you had a superpower, which superpower would you like to have? So I love seeing all your creativity. We always get some really fun answers to these questions. So what would your superpower be? Okay, they're coming in. Invisibility, that's always a great one. Teleportation, I would love that. I would absolutely love that. Yes, because I don't like to really fly on airplanes. And then, of course, the next one is to fly, which is great. Time travel, teleportation for sure. The ability to eliminate homelessness, beautiful. Flight, ability to fly. Fly is a big one. Talk to animals, fly. Again, fly is a big one. Talk to animals, invisibility, fly. Oh my gosh, so some good ones here. I think we've all put some thought into what our superpowers would be if we could do it. Ability to part traffic, etc. Wonderful. Great. Well, thank you for participating and just getting us going here. So again, if as you have questions as we go through this, feel free to put them in the Q&A. We will be monitoring that, and we will get to as many questions we can at the end. But to kick us off, I want you to know that we have a very special guest with us today. Jessica Halsey is founder and CEO of Addiction Policy Forum. And addiction is a personal issue for Jessica, as she will share here in a little bit. In 2015, Jessica founded the Addiction Policy Forum to help families and patients struggle with the disease of addiction. Since then, the organization has set out on a big mission, grown a team of dedicated and talented staff, and raised funds to deploy needed programs and resources. Jessica and APF have been a long-term partner in delivering fentanyl presentations, and I am thrilled to introduce you to Jessica.
No, thank you, Meredith. It's so great to be here today. I really appreciate the invite and to be able to share with you all. I'm going to take a second and share my screen. Is that working?
Yes.
Wonderful. All right. So as Meredith mentioned, I run the Addiction Policy Forum. I founded the organization 8 years ago now, if you can believe it, but I've been in the field for a long time. I do this work because of addiction's impact on my own family. My parents struggled with heroin use disorder, so early years were mostly homeless and very chaotic, and then placed in the foster care system. And then finally placed in a kinship care placement with my grandparents. As part of that kinship care placement, the Child Welfare Services sort of required us to go to, for two things, to go to mental health care. So I met weekly with psychologists through sort of elementary, middle, and beyond. And that was a big part on processing and sort of addressing the trauma and sort of displacement that we had experienced. But they also identified and assigned a big sister to us. So I met my big then. We're still friends today. And she was an incredibly important part of sort of my pathway to really changing some intergenerational trauma, addiction, and other behaviors that were unhealthy and unhelpful. So first woman I really met and spent time with who had gone to college and took me to my first poetry reading. And I graduated Princeton University as an English literature major. So sometimes just for a heartfelt thank you to all of you who are bigs and our mentors, knowing that there are other possibilities and seeing other pathways on how things can go can make such a big difference, particularly for those of us who are kids affected by addiction within the home, sort of parental substance use disorder. So thank you for the work that you do. A lot of what we do at APF is focusing on bridging gaps that exist and making sure that we translate the science for key volunteers and leaders like you is one of the places we really focus attention on. We and things like this are fentanyl training, some of our other programs that we have for adolescents, for caregivers, for adult helpers, for physicians and clinicians is really part of that work. Today, I'm going to sort of share with you a little bit about fentanyl and also a little bit on strategies and tactics you can take to keep your littles safe from addiction, right? It really, and from a public health perspective, it's the disease space, it's the illness and the developments of that illness. That's the target for prevention efforts, right? So we'll talk a little bit about some things that all of us can do. We also know that the prevalence of addiction in the U.S. is incredibly high. These numbers actually have just changed. Just some new HHS data that came out, I think, last week. We're up to 48 million Americans ages 12 and older with a diagnosable substance use disorder. That's a lot of people. It's 1 in 6 in the U.S. Most of that is alcohol use disorder. So about 75% of those with an addiction today are struggling with AUD, alcohol use disorder. We're also seeing some trends among adolescents that are troubling, including increased alcohol, nicotine, and cannabis use. And we also have lots of fentanyl concerns because of adulterants and fentanyl being present in a lot of our counterfeit pills. As well as a lot of illicit substances that are out there. We also know that addiction is treatable. 21 million Americans are in recovery today. If you're diagnosed with a substance use disorder, you have between a 60 to 75% rate of reaching remission, which is 5 years in stable recovery. So if you look at this from a healthcare perspective, and you're a doctor, let's say diagnosing an illness, having a 60 to 75% survival/recovery wellness rate is pretty amazing. So this is a entirely preventable illness. It's also a treatable illness. So we've made a lot of advancements over the last couple decades. I mentioned this. This is sort of the breakdown in the prevalence of SUD by type. So really, it's alcohol use disorder, right? And then you sort of conflate that with most people use multiple substances when they start to misuse substances for a variety of reasons. But we're also seeing increasing rates of cannabis use disorder, opioid use disorder remains a concern, and then methamphetamine use disorder followed by cocaine. So today we're really going to first start and dig in around fentanyl. So fentanyl is a synthetic opioid, right? So it's created in a lab, does not come out of sort of poppy fields, right? So all those crop eradication efforts, making a lot of progress in that space. This is synthetic opioids. It's also incredibly powerful. Fentanyl is 50 to 100 times more potent than morphine. Particularly if you don't have a tolerance or have had previous exposure to opioids, even sort of your first exposure can be fatal because a very small amount is actually considered a lethal dose. So why do we have fentanyl out there? Why is this even prevalent if it's so dangerous? Well, it really is an economic issue. Those that bring drugs into the country or are part of sort of the availability of illicit substances are adding fentanyl into our current supply because it is cheaper, it's more easy to carry and smuggle in, fairly easy to create or replicate in labs, and sort of obviously less care or concern about health consequences or overdose. It really is sort of being driven by the economic issue. It now is the most common substance involved in all overdose deaths in the United States. Our 2021 data shows that we had about 299 deaths a day, right? So it's about 110,000 fatalities due to overdoses. Now, the thing that's changed with our recent data is there's an increasing amount of fentanyl being found in our stimulants, which includes methamphetamine and cocaine, as well as counterfeit prescription stimulants like Adderall. And we still have fentanyl present in heroin, as well as counterfeit opioids. So if you think you are taking a prescription medication that looks real and like it's legitimate, it's even hard for a pharmacist to tell the difference between some of these pills. So it's really important that we make sure we are reinforcing the message to all of our networks, but particularly to young adults and adolescents, that even if it looks like a legitimate prescription, to not take any prescription medications that were not prescribed to you and you picked up yourself. You know exactly where they came from. The DEA is seizing such a large quantity of counterfeit pills that have fentanyl present in them, and we applaud their efforts, but we need to make sure that the education piece is happening simultaneously. Some of the researchers in this space, they talk about like the waves of the opioid epidemic. And if you are clicking on your Netflix and see all these like Netflix shows about overprescribing of medications and sort of a causal relationship to opioid use and opioid use disorder in the US, that really is like a 2000 to 2007 narrative. That's considered like wave one of the opioid epidemic. There's been a lot of changes to prescribing, so we're not seeing sort of legitimate prescriptions driving. You see how much that's come down on the RX opioids piece compared to fentanyl with no stimulants. Fentanyl with stimulants is really part of this fourth wave, and then we're seeing sort of the heroin and the without fentanyl in it, and the RX opioids being sort of a much smaller proportion of what's contributing to overdoses today. Again, fancy chart that says we need to be really careful about our messaging and doing some public health education, that both stimulants and things that look like legitimate prescriptions do have fentanyl in them, so we need to be careful. This is a quick sort of breakdown on overdose fatalities. I'm going to just sort of pop through this really quickly, but you can sort of see the portion. So the fentanyl piece is in blue, so increasing over time. And then you see stimulants with fentanyl present is the purple. So our 2021 data shows that 32% of our overdose fatalities were driven by the combination of stimulants and fentanyl. And then the fentanyl piece without stimulants was still up there at nearly 34%. So talking about this, whether that's at your workplace or with your family or with your littles, of really making sure we're raising awareness about the dangers of fentanyl is incredibly important. There's some differences in geographic breakdown. We're still seeing a lot more methamphetamine towards the West Coast. And then we see heroin still very much present in like Appalachia and the Midwest, and it sort of changes. Regardless, since we have fentanyl in so many of our substances of misuse, we really want to make sure that all regions in the U.S. are reiterating these really important public health messages. So what can we all do? So I'm a grown little, but from a little perspective, thinking through what my mentor, my big could share with me, thinking through my messages that I can deliver to, I have 3 teenage sons, 2 in college and 1 in high school. And also thinking through whether you're a coach or a teacher or anyone who sort of is has contact and really the ability to deliver some of these messages to adolescents. There are strategies that we can employ to keep kids safer, right? I kind of go over these top 5: starting the conversation, delaying onset, coping skills, refusal skills, and early intervention. And I'm going to try to get through this in like 15 minutes, so we have plenty of time for Q&A, and I want to make sure that I can respond and answer any questions you have. So when we talk about starting the conversation, one rule that we have in my house is, and we do in a lot of trainings when we're out there in communities and schools, is anything that's mentionable is manageable. And I know it can be very awkward to have the drug talk or have the talk, whichever one it is, and we can avoid these conversations. Sometimes it can be confusing on what you can discuss as a big, and not being a parent or caregiver. What do you have to clear? But there's so many different types of conversations that you can have for all age groups, right? Whether that's talking about keeping your brain safe and healthy, which a number of things go into that, like getting enough sleep and eating healthy food and making sure you're not introducing harmful things to the adolescent brain, like alcohol, nicotine, cannabis, or any prescriptions or other drugs. Talking about coping skills, talking about how we address and handle stress in everyday life. There's lots of ways that we can talk about this, because prevention isn't about talking about what drugs are or what to look out for. We disproved that a long time ago. Prevention is about improving protective factors and reducing risk factors for an adolescent, right? And risk factors can be not having clear expectations, not having good parental supervision, having trauma at home or adverse child experiences, having lots of availability of the substance, having early onset of or start using any of the substances early. These are all risk factors. And then protective factors are like the opposite of that, pushing back when we use anything, right? Because remember, alcohol is the number one thing that is causing addiction in the US. So when we talk about pushing all use of all substances back, and then when that use begins, really minimizing it, and knowing how to keep our brains safe, these are all sort of health and keeping your brain healthy conversations. Other protective factors can be setting clear expectations. Sometimes just having someone tell you, I don't really want you to do any of that stuff when you're in middle school. I don't really want you to be doing that in high school. I don't think that's great for you. I've read some stuff about, the effects of nicotine or cannabis on an adolescent brain. It really worries me. I hope that those are things that you can avoid doing to this beautiful brain of yours at your age. There's so much that we can do to reinforce the protective factors. So any age, you can start the conversation. The fentanyl piece can be a nice conversation starter. Hey, you can check in with a caregiver or a parent on the topic. Sometimes brain health or healthy coping skills, the age conversation. If it's a kindergartner little, it could be not taking medications not meant for you, and how to stay healthy. There can be more skills-based conversations if it's a middle or a high schooler. But having the conversation and also knowing that someone cares enough about you to say there are some things you can do to never develop an addiction in your life, and I care about you so much. I want to discuss that. So start the conversation. Lots of different ways. Lots of different components are part of prevention. It really isn't drug education. On the talk early and often piece. I like to have lots of conversations about explaining what substance use disorder is. It's a health condition when substance use gets to a point where it actually changes the hardwiring of this really important part of your brain that kind of helps us and reinforces things that we do to survive. There's a QR code if you want to check out this video. We have a version that's made for kids as young as elementary school, and other versions. We have a cool version that's like a hand-drawn animator that even my very critical teenage sons think is not half bad. But you can have the conversation about, hey, this is what science tells us substance use disorder is, and there's some light dose prevention or some health messaging that's in there, and you could have a conversation if they have questions. If you can't answer a question, that's okay. Be like, oh, that's a great question. We're going to reach out to Meredith and our good friends at DEA or Big Brothers Big Sisters and see, or my new friend Jess at APF, and see if she can answer it. Kind of tackling the awkward, having the conversation is signaling that there's some expectations, that they know where to go to ask questions, and someone cares about preventing substance use. The other piece that's important is this delaying onset piece. I find it so interesting. It's over 95% of adults in the United States are going to be consumers of alcohol once they're of age or once they're adults. So the reality is that this isn't sort of prevent substance use, because our primary substance of misuse is controlled but legal after the age of 21. But the age at which that behavior begins is the single biggest risk factor for the development of addiction. So let me say that again. The age at which use of anything begins is the biggest risk factor for developing an addiction, right? 21 is actually a little early, if we're being honest about brain development. Girl brains are fully cooked around 22, boy brains between like 23 and 25. So we just sort of split the difference and say in your early 20s. And the substances that we introduce to our brain during that rapidly developing time makes a difference, right? So the age matters. And the work that we've done at Addiction Policy Forum, of all of our folks that we work with that are in recovery today or in active addiction, receiving treatment, average age of when they started using substances was about 14. And that ends up being one of the biggest risk factors, right? For a number of reasons. One, the brain is more vulnerable. You're actually creating neural pathways that start associating substance use with those trigger events or those activities, whether that's social, you're relieving social anxiety by using substances, you're handling stress by using substances. So you're changing your neural pathways at that process. It also is creating these coping skills on how you are managing day-to-day tasks and stressors with substance use. So lots of different things go into paying attention to that age, right? When you start using before 18, you have like a 1 in 4 chance of developing an addiction, but that's like 1 in 25 when use is delayed, right? So think of that, a 1 in 4 chance of having sort of a chronic illness when use begins too early versus a 1 in 25 chance. So very, very big differences. I mentioned this like brain development piece. I'm not a neuroscientist. I'm not a researcher. I'm just sort of a nerdy nonprofit leader that likes to translate all of this amazing science that's coming out of research to make it understandable to people like me, practitioners, patients, you name it. And the neuroscience that we have around adolescent brain development is just fascinating, right? So if you have any 5 to 18-year-olds in your life, which I'm assuming you do as bigs, look at those gorgeous brains. There's like red and orange and yellow and green and just beautiful. That's all these like the rapidly developing. It's all that neural plasticity, all this like great. It's like a Lamborghini brain, right? Not my brain at 47. I don't even have any of this like green over here at 20. I got a very boring blue brain. I'm going to be a lot less susceptible. There's a lot less harm. Let's say if I do have sort of nicotine or alcohol impact, I still have to be careful because I do have genetic risk, but I have this sort of fully cooked brain, right? And the way brain development happens is you don't fully connect everything. If you think of it as your brain starts connecting everything over time, the last part to come together is your prefrontal cortex, which is where higher reasoning and decision-making reside. And that's not actually fully wired in until your early 20s. That's why we have more impulsivity, right? More risk-taking behaviors among adolescents and young adults. So really, when we can have this conversation about, and there's like good and bad parts of it too, I don't know if you've ever noticed how, at least for me, I can't learn a new language or learn a new instrument or anything at this age. It just doesn't happen. My learning capacity is different from these gorgeous green and tie-dye looking brains. So you can learn things more quickly. It's more superpowered, but you don't necessarily have the brakes on, and there's more vulnerability at the same time. So imparting this lesson that adolescents have something better than adults that they should protect, I think is an interesting way to sort of start the conversation and empowering the adolescent to know how they protect their own brains. You got to get plenty of sleep. You need more sleep than an adult does because of this rapid development. You also need to be really careful to introduce things that harm it. And you also need to, on the positive side, one, coping skills, very important. You change your neural pathways. And I try to explain neural pathways as like the hiking trails. The more trails you use, the wider and the more worn they are. So if you're creating these pathways that I handle stress or I handle social settings by using the substance, your brain starts to remember that. But the gorgeous thing is the younger you start changing this, the easier it is to build new hiking trails in your brain. And other activities that we have, like reading and new experiences, learning new things, that has even more benefits to this rapidly developing brain than mine. The other thing that I added in here is that it's about preventing addiction, right? I'm not going to prevent all substance use among my teenagers. They're probably, once they're over 21, or even as they're in college, are going to have some alcohol use. But when we look at preventing addiction, if you have an adolescent or a young adult that you work with, or even someone in your friends or your family network, if use has begun, all is not lost. We want to focus on the frequency and the quantity, and also the types of substances that are used. So, okay, so you've experienced vaping, understand, but really making sure that this is not a common occurrence. Talking about nicotine or smoking cessation programs, reducing frequency and quantity are two of the key factors, in addition to delaying onset, that's going to prevent addiction long term, right? So this isn't all or lost once you sort of magically cross this line that we don't have public health approaches. We're focused on disease prevention, and there can be very helpful pieces of advice and guidance that we can give to make sure that they're protecting themselves as much as possible and preventing an SUD in the first place. Talk about healthy coping skills. It's so interesting to me. A lot of addiction is really either sort of these learned behaviors or coping skills that we accidentally develop in our adolescence. And then we can't, and it's hard to sort of break those habits. And I don't know about any of you, but habits are hard to change, especially health habits. I ate way too many brownies during that pandemic and lockdown, and I gained some pounds. And getting that weight off is just so much work, and changing some of those patterns about what I was eating or drinking, how often I was exercising, how I was like processing the stress of the pandemic, sort of eating my feelings and then changing those behaviors. So habit change can be difficult. And then on the outset, if we're more sort of deliberate about understanding the correlation between coping skills and substance use. I have this slide is these are some of the most common underlying factors to substance use. This can be for adults, but also adolescents. When you're using alcohol or other substances to unwind or decompress, we've got like wine o'clock culture that's going on. And by the way, no amount of alcohol is actually self-care or healthy for your brain. So it might be in activity that an adult partakes in, but not necessarily adaptive. We use alcohol, other substances to socialize. We use alcohol or other substances for stress management. And so when we start, let's say you're not going to jump into like the fentanyl conversation with your little. I have conversations all the time with my teens, and when we're out in communities about, hey, let's talk about your coping skills inventory. You can even print off a inventory checklist, and I have one on my website if that's helpful, to say like, hey, what do you do? What are the top 3 things you do when you have a fight with your parent, or a bad day at school, or you get not a great test results back on a test that you just took? What if someone says something mean or a bad comment on social media? what's in your toolbox to manage stress, right? Because we see it's like quick and easy dopamine when you're using substances, because what a lot of people are looking for when they use substances is rapid mood change, right? But the thing that's so interesting is alcohol, or let's say cannabis, might feel like a rapid mood change. That's better, but the cortisol studies and some of the science that shows us that it actually increases stress over time. It's sort of, so it's at a it feels like it's a quick fix, but over time it actually makes stress and anxiety worse. So when you take the time to just think through what is adaptive or healthy coping versus maladaptive coping, you're not really talking about or having the drug talk with someone. This is really just about healthy human behavior. So adaptive coping or healthy coping is, I have a fight with my parents, or that boy broke up with me and I'm heartbroken, and I go to my school counselor or a therapist. I exercise, I hit the gym, I do yoga, I journal, I meditate, I put on my Headspace app, I do an activity that's healthy for me. When we start having this conversation and remind adolescents and young adults that they have some autonomy and some decision making, and being deliberate and careful about what coping skills mechanisms they're setting up as adolescents, because we tend to use those into adulthood. And also thinking through how we ourselves are handling stress so we can make changes. Maladaptive coping is not just substance use, social isolation, oversleeping, and then behavioral or sort of process issues like gambling, risky sex, disordered eating, shopping, other things. When you're on Amazon getting like 40 Prime boxes delivered to you because you're stressed or had a bad day, probably maladaptive coping. Better than substance use or heroin use, probably. However, when we're more when we're smarter and more aware of our own behaviors, and we can have these conversations with our own networks, we can help to make sure that we have a bigger coping skills toolbox. So one of the things I always say when I'm out is, if I said to you today, wow, it was like a kind of a tough Friday, I had to have that like performance review with that employee, and I was rushing around to get the kids, and I forgot this assignment was due. I think tonight I need what do you think I'm going to say? You think I'm going to say I need a drink. I'm going to have a glass of wine. I need to unwind, decompress. When we start being more cognizant of those coping skill sort of habits, coping habits that we're setting up, there's coping processes. And we can start replacing that with like, well, I had a pretty rough Friday. I'm feeling a little stressed and want to unwind or decompress or really enjoy my weekend. I think I'm going to go to the gym, or I might need a walk, or I'm going to call a friend, or I'm going to see if I can schedule therapy or journal or whatever it might be, turn on my own Headspace app. I think we can model some behaviors as bigs, as friends and family members to be thinking through what our coping looks like. The number 4 on my list is refusal skills. This is jumping kind of straight ahead. I think this can actually be sort of an initiating conversation. Be like, hey, some data just came out that like vaping and nicotine use is super high in a lot of middle and high schools. So I just thought I would check in with you about maybe some refusal skills if you wanted to practice together. And I can tell you a little bit. I have 3 sons. And each of my boys has had a very different take on this situation in high school. So there's these categories of refusal skills. And I also have a video explainer on refusal skills that we can send to you if that's helpful. But you have simple, declarative, excuses, alternatives, and reversal. And of these, so my oldest, it's interesting. He was kind of like a simple / reversal guy. So he's like, no. Why would I do that? Or no, and why are you doing that? That's like super not good for you, dude. Do you want to talk? So he was like I feel like in birth order science, that very much feels like an oldest response to this when you have a mom who works and leads an addiction nonprofit. My middle, who's my cool guy, it has been just one excuse after another, sometimes revolving around me and others not. It's like, nah, I'm the designated driver. And he likes to be the designated driver because it It gets him out of risky situations. Sometimes it's been no. My mom is like, let me tell you, and she drug tests me, which I have done once or twice. But I was always his excuse. My youngest, it turns out, is more of an excuses guy too. But it's mostly related to sports. He's like, nah, I got lacrosse practice. I ain't here for that. It's like it's gonna mess me up. I really want to do well in that game. Or it's a excuse that I'm super strict about those things, or his coach is super strict. So these are examples. It can be like, hey, just in case anyone like wants you to do something really dumb or really risky, let's chat about some ways that you can think through. And I always encourage people when you're practicing with an adolescent to do a push. So be like, oh man, they have the initial refusal. And then if you practice having peer pressure with an extra hit, like, what's wrong with you? Like, just come on, come join us, whatever the line is. Then you practice making a second either repetition of your first refusal or another one. Be like, hey, and sometimes it can be an alternative. I said I'm good with that, but is there a Sprite? I could use some water. Let's order some pizza. So you can actually help build the toolbox of how you respond in some of these situations, because it's hard to say no to peers, right? How many of us have said yes to things even at work that we maybe wish we hadn't, because you have this sort of knee-jerk reaction to say yes to things and want to be included and sort of go along with those that are around you. So taking some time on refusal skills, I think, is worth it. And my last item just to mention is substance use is increasing. So we're seeing more patterns of sort of utilizing the big three, which are alcohol, cannabis, and nicotine, to manage day-to-day stressors, to work on rapid mood shifts, and to change your mood abruptly. But if you start to have anyone in your life who is struggling or maybe misusing substances after abstinence, and when use begins, then you start seeing misuse and then problematic behavior. So there are warning signs. In the diagnostic side for clinical, there's actually levels of severity for substance use disorder, like there are stages of cancer. I mean, once I started kind of putting information together for family members and patients, I was like, why is no one telling us this? So you typically have 2 to 3 symptoms if you have a mild substance use disorder. You have 4 or 5 symptoms if you have a moderate substance use disorder. And you have 6 or more symptoms if it's a severe substance use disorder. Now, severe substance use disorder is what we consider addiction. So all of the folks who currently have like a severe SUD in the US, they had the progression. Sometimes it's quick, sometimes it's over many years of having an increasing number of symptoms. And the symptoms range from developing a tolerance to the substance, if you're having to drink more to have the same effect, continued use despite consequences, health consequences, and you continue to use, changes in your family, work, volunteering, or your lifestyle, disruptions, all those items. And when we start to notice that someone is struggling, we can say something, right? Much easier treatment, typically not even needed when we're disrupting misuse or problematic use behaviors when it is a mild substance use disorder versus engaging and intervening when it's severe. So speak up. If you're worried about someone's substance use, remember that 60 to 75% rate of the prognosis, or the rate of recovery and reaching remission, which is 5 years in stable recovery. We can recover from this. We can change use patterns so we stop progressing up these stairs. If you look at these as stairs, and sometimes just knowing that someone cares about you is going to be like a really key component to changing your behaviors and getting some help or talking to someone. And we're here at APF and have some programs and booklets and trainings and e-courses available if you have someone in your life that you feel like you need to talk to them about their substance use. So say something, disrupt the process. There's so many tools in our toolbox to make sure we can get people the help they need. Kind of as a final reminder, it's so interesting. We're still working so hard to make sure the public understands addiction as a health condition. And like any other disease, or illness that we're trying to tackle, right? You reduce the number of people who contract it in the first place. You work on early detection, early intervention, quick treatment. You want to help people as soon as you can so you can improve their outcomes, and you want to improve your survival rates. Our work that we can do for those that work with youth is really reducing the number of people who contract this in the first place. And then when necessary, saying something to intervene early or to make sure we disrupt the progression that can happen when use is not moderated. And we all have a role to play with ourselves, within our families, our friend networks, and with those that we work with to pass some of these pieces along. I have a couple of resources. I'll just go over this really quickly. If you do have a little who's like me, impacted by addiction in the family or parental substance use disorder, I made a toolkit for that. And it's interesting. Sometimes we don't need the big things. Children are beautifully resilient, but we do have a poster that's in there that can be a helpful conversation. If you have a parent with an addiction, the 7 C's, which was developed by Jerry Moe at Betty Ford Hazelden, super, super important. I didn't cause it. I can't control it. I can't cure it, but I can take care of myself by communicating my needs, making healthy choices, and celebrating me, right? And some of those pieces about delaying onset, being aware of my own coping skills, being aware of my genetic risk, those are part of making healthy choices and changing your own trajectory. All those pieces I talked about, delaying onset, the beautiful adolescent brain and the boring grown-up brains, mind your genes component, refusal skills, that's all part of our completely free open source Protect Your Brain campaign that you can find on our website and YouTube channel. We also have a vaping course that's out there. I think like hundreds of schools are currently use that as sort of an education piece. So whatever resources we can provide, but having this conversation, saying something and signaling to those that are either adolescents or young adults that you care about them and you want them to protect your brains, to protect their brains, is such an important message to convey. And then we have a few pieces that we call our opioid prevention campaign that kind of reiterate these 5 strategies that I shared with you. So I think I finished just in time. So we'll kick it back to Meredith for questions and next steps.
Fantastic. Jessica, thank you so much. You are a wealth of information that was beautifully laid out. Thank you for taking that from the scientific people and putting it into words that we can all understand and use in our daily lives. So thank you for that. Wonderful. We have had a couple questions come in, Jessica. The first one is someone asking about the fact that their little's parent gave them permission to speak with them about substance use. When is the little old enough for me to talk with them about opioids and other drugs?
I think there's a different message to convey no matter how old the child is, right? If you have an elementary schooler, I think talking about refusal skills, mentioning the big 3, opioids are typically not the first substance that adolescents will misuse. But it could be a good hook conversation because we're so much new data and we're worried about it. You could start with the protect your brain conversation. You could start with coping skills. I'm going to work on a video explainer about neural pathways and use my new hiking trail metaphor that I'm super excited about. But I don't think I started having these conversations with my own children when they were like 5 to 6, right? You should not take medications if they're not for you. You need to be really careful and protective of your gorgeous brain. You need to get plenty of sleep, and you need to not introduce things that harm it. You need healthy food. You need to exercise, et cetera. I think at the refusal skills conversation, it's even easier to start that if they're in elementary school, when they might be sort of more open, and then you can like reinforce it as they get older. I think for middle and high school, or if you know that your little is maybe using different substances or has tried different substances, which is, it's unfortunate, but we still have a role to play. Remember, it's not black or white thinking. It's not all or nothing. We need to say something and meet our adolescents wherever they are in this continuum to say, hey, I'm really concerned about all this information about fentanyl. Can we watch this video together? Can we practice some refusal skills? Because I don't want you to ever take any pills that are not prescribed for you. I really want to make sure you're never getting in the car with someone who is under the influence, and that's both alcohol as well as cannabis. I really want you to break some patterns that you've shared during your own family history about substance use disorder. And one of the most important things you can do is delay onset. So don't use anything until you're much older. And you can say, like, I just have a new friend named Jess who was a little sister and had 4 generations of addiction before her. And she waited until her early 20s to, introduce anything harmful to her brain. So she was able to be super successful. I mean, I think I did okay, but use me as your new friend that you met. But any age is the age to start talking about this, because you are signaling that you care about them, you care about their health, and that you're reinforcing that addiction is preventable.
Thank you. And Jess, yes, I think you did okay. I think you did just fine. And thank you for addressing that, because a couple questions have come in about that age question on how to start that conversation. So you're saying really any age, just make it age appropriate and things like that. So thank you for that.
And for Brian's question, I think talking about coping skills is the way to go. It's such a beautiful way to start the conversation. There's coping skills inventory lists. You could, practice some mindfulness. I have my boys use the Headspace app, so you can learn to be more self-aware, recognize your thoughts, recognize that they're all not true. They're not all true. And then work on that emotional regulation piece. And when you start talking about healthy coping skills, it's just such an easy way to kind of be like, and there's some non-healthy coping skills. Some adults have unhealthy coping skills. You might see some unhealthy coping skills on social media or in TV and the movies, but you're in control of the coping skills that you develop today. So how are you going to cope with that, right? Because we can't take over these parts for our kids, our adolescents, our littles, but we can give them some guideposts and some guidance on how they can be much more self-aware.
Great. Thank you for that. And that was in response to Brian's question about prioritizing, what you're talking about. So just a real quick question. Will Jess's PowerPoint be made available to us? So yeah, it will be, correct?
Yeah. Happy to send you my slides.
Okay, great. All right. Well, with that, there are no more questions at this time. So want to thank everyone for being here and thank all the bigs for your work. I want to turn this over to Laura to have some final statements. Thank you.
Great. Yeah. Thank you so much. Kind of connected to that last bit of the conversation and the questions at hand, I would definitely also utilize your match support specialist at your local agency. As an example, with my own children, I know some of these conversations, my younger one, it definitely has a little bit more tendency toward anxiety and toward thinking about extremes. And I remember she was quite a bit younger at the time, but when she started asking some questions about celebrity deaths, what happened to Prince, what happened to Michael Jackson, and in those conversations, she just became very focused on medication and death. So I definitely handle my conversations with her a little bit differently than I might my older child, who doesn't make that leap in her brain. So I think your match support specialist knows a lot about your little, has had conversations with the parents, and can really help you in deciding, how do I approach this conversation based on the particular personality and things going on in my little's life. So other than that, I would just like to really thank Jessica. Every time I'm part of these, I take away something new. And I would say, so I've been joining now in these sessions for a year and a half, and it's definitely helped me as a parent. Refusal skill conversations have been happening in my house since the very first time you brought it up. And so I just think there's a lot of helpful tools. We appreciate everything that you bring to the table. And I just love your story that you were a little, and that you understand how mentors and bigs can really help a child in need of having some of this guidance. Also, thank you to the DEA EF, our partners there. Meredith, you've done a great job. There are also folks behind the scenes helping with the chat, helping with getting our slides up, that type of thing, helping with scripting. So thanks to everybody at the DEA EF. And also thanks to our funder. We are so grateful for the generous funding that we get from the OJP and OJJDP to make these sessions possible. So, and thank you to all of our attendees today, our bigs. We are grateful for you, and we are really wishing long relationships between you and your littles, and that we can continue to help provide tools to make those relationships thrive. So have a great rest of your day. Have a great weekend. And it will take us a week or two to turn things around, but we will get out the materials and a recording and the slides sometime in December. Thanks, everybody.
you.